So I'll just get the ball rolling while we're waiting for Aimee, and hopefully she will pop in. But we were gonna start off with just jumping into kind of a quick overview of what we've been diagnosed with. And so I'm just going to jump in and I wrote down a little notes of my history and I'll just jump in there. So when I was 19, which was like, now I can't do the math, but about 20 years ago, yeah, about 20 years ago, I had an earache. And so I went to my doctor, just complaining of something in my left ear. And it was, I think, about 3 doctors later that I went into surgery for a red mass in my ear with an ear, nose, and throat doctor. And he discovered a glomus tumor in my left ear. So because he wasn't prepared for a surgery on a glomus tumor, I left that surgery pretty much. He had removed some of the mass. But then after that surgery, I went to a new doctor, Dr. Weisskopf, and I'm in Arizona, and I got treated eventually with 3 days of CyberKnife, and that was my first treatment with what he called paraganglioma. So that was the first time I heard paraganglioma, was about 6 months into this earache. Lacey, why don't you go ahead and start with your story, and then I'll probably continue mine as we go.
Yeah, no problem. Hi, everybody. I'm Lacey Koelling. I live in Alabama. So my story kind of started in 2019. Just before that, the year before that, I had felt a lump in my throat. Nothing else like out of the ordinary that I could tell. But I felt a lump. I went to my primary care and said, hey, I have this. We did an ultrasound on it, and they were like, you just have a swollen lymph node. You've probably been sick. No big deal. Fast forward about 8 to 9 months later, I deployed and I started feeling kind of dizzy. I'm active duty in the Air Force. So I was in Southwest Asia. I started feeling pretty dizzy and I actually ended up passing out and hitting my head. And when that happened, I actually got medevaced out of the theater that I was in to Germany because they thought that I'd potentially had a seizure, and that's why I had passed out. So when we got to Germany, I did a full seizure workup. I did the very cool test, which I forget the name of it, where it's all over your head. And then on the head MRI is when they actually found that I had bilateral carotid body tumors. And that was the first time that I had been introduced to that and been introduced to paragangliomas. So from there, I went to Walter Reed in Bethesda, Maryland, and the tumor essentially was pushing on my carotid artery and kind of just causing me some blood pressure issues and some other things. Power supply was off. From there, I had the first one removed, and then I started going on. I had an annual workup after that. I did genetic testing as well initially, but really I was like, this is cool. I have one more tumor, no big deal, recover from surgery. No issues from there. I had the second tumor removed back in 2021, right after COVID. I was supposed to have it done a little bit earlier, but as everybody knows, COVID was a little bit of an adventure trying to get surgery scheduled from there. And then in 2013, on my annual screening on my dotatate, that's when I found that it was now metastatic, and it had spread from kind of around my lungs through my pelvis. So a very shocking experience to go from what I thought was at the time in 2019, I was told, or 2018, that I was told that this was benign, probably would never be metastatic, no issues and nothing to worry about, to screeching halt in 2023 when I was told that it was metastatic, and that my initial oncologist was like, the world is crashing. I'm no longer at that point, a year later now, but that was the initial diagnosis, and I can talk to that a little bit later too if anybody has questions. But Aimee, do you want to do announcements, or Jenn, do you want to go back in and pick up your story from there?
Yeah, let me just jump back in because there was some commonality. So I started with a left glomus tumor, and then I actually had a right one as well, but I had only had the left one treated. But then down the line, we're talking like I was getting checked every 2 years, and I had bilateral carotid body tumors as well. So those were all determined paraganglioma related. And so over a series of 7 years, I had 3 different sets of radiation to treat the left, the right, and the carotid. Um, and then, but I was also told these were benign tumors and that, you know, I was getting MRIs every 2 years and saying that after the radiation each time that there was no change and that they were stable and all this like what is not normal, but felt like, okay, there's not too much to worry about. I just have to keep checking on these every 2 years. So fast forward to 2020, the fun year for everybody. That's when, right before COVID, I was looking at my history because I had forgotten a lot of this. I had gone and done genetic testing right at the beginning of March of 2020. And that's when I found out I had SDHD, which confirmed that my paraganglioma pretty much came from my father and grandfather, which was also part of that story in 2006. Is where my doctor connected it to the carotid body tumors that my grandfather and father had. So yeah, this is a lot. So then because of COVID, I didn't actually go follow up on this SDHD genetic mutation diagnosis till November of 2020. And then that's when they gave me this laundry list of tests that I needed to now take. So going from an MRI every 2 years to like there was like 10 different items, and I have the list, but I won't bother right this moment. So then in January of 2021, I went in for my first round of these tests that I was going to have to do every 6-12 months, thinking that this was just going to be what it is for the next, 40 years probably, and didn't think anything about actually picking up metastatic paraganglioma. And right before my 35th birthday, I was diagnosed with metastatic paraganglioma, and it had spread to my liver, my lymph nodes, my spine, and other areas, etc. So yeah, Aimee, let's because we missed our intro. Why don't we go with our intro first? We kind of just dove into our diagnosis. Oh, we can't hear you though.
Okay, so I'll do an abbreviated intro and I can go through some of the Awareness Week things at the end. So sorry about that, everybody. Power troubles, there's always something, I think, sometimes. So anyway, I just want to welcome everybody today to Mysteries in Symptom-Free Disease. Obviously, you've met Jennifer Testamarck and Lacey Koelling, our 2 special guests today. Both of them are very active in the PPA, and you've seen them, or especially in Jenn's case, her work online with us for a lot over the last couple of years now. I do want to remind everyone that's watching today that the information that's presented in today's conversation is for informational and support purposes only and should not be considered to be a replacement for the advice of your physician who is familiar with your case and knows your disease status. So we're here to give you support and give you a perspective from 2 different patients, but definitely not to give you medical advice relating to your case. Otherwise, I just want to thank Jenn and Lacey both for participating today and also for pinch hitting for me while I had some technical difficulties. I really appreciate it. So I don't want to interrupt your flow because it seems like you've got a really good one going. So Jennifer, what was that like though? Especially right before your birthday to get news like that. That's not great,
Yeah, probably similar to Lacey, when the moment you're sitting across from your doctor getting a metastatic cancer diagnosis, and my doctor called it stage 4, and my doctor's note said incurable. I mean, your life kind of changes in that moment. That was 3 years ago now, so it still hurts to hear it. But it's yeah, it was just I had actually just 6 months before that lost my father to cancer. So I had I was still in the grieving process and then got my own diagnosis.
I'm so sorry. Yeah, and did you, I hate to ask, I don't know if you feel comfortable talking about it, but was your father's cancer the paraganglioma that wound up, or was it something else?
I did ask the genetics doctor about that, and pretty much because they didn't have his case, they don't know the answer and they can't really specify. But he had esophageal cancer.
Mm.
But he did have, it was never determined by his doctor to be paraganglioma, but he had the carotid body tumors, and then was then at age, I think he was like 63, I want to say,
Oh
he
my
was
God.
diagnosed with esophageal cancer. So that's what
Right.
kind of led me to go back and do genetic testing. Was I was like, okay, I've already had paraganglioma from my father, and he's in the hospital right now dealing with his cancer. I probably should go start to do some health checks again on my own. I was already doing the MRI every 2 years, but I thought genetic testing was on my to-do list to do. And so finally I did. And that's kind of that's what led to me getting tested and finding the metastatic.
Wow. And Lacey, I know you just said you were, I think, roughly the same age then as Jen when you found out that you were metastatic. Is that right? If you were initially
Yeah.
diagnosed in 2018?
I was. So in 2018, I was 27, 20 or 28, 29. And then when I was metastatic, it was just after my birthday. So I think I was just 34 at the time. So I also had a very young daughter. And obviously she's still very young. But being a new mom and finding out that you're metastatic was just a very earth-shattering, especially there's so many questions when you initially get the diagnosis. Like Jen, I also have SDHD, which is so interesting, some of our similarities between our cases, because sometimes it's hard to find, and it's a very isolating disease to find people who have such similar cases to you. So it was very difficult to hear all of that and to know about it. And just the difference, I think, in like when you find out. So in 2018, when I first found out, everything was benign. It was, you're benign, you'll have annual screens, but never expect anything ever again. And then, as a lot of you probably know, I think it was 2022 when the WHO changed the classification. That it could be metastatic. So then in 2023, when I was diagnosed, it's just such a different world. And it's amazing how the science and the research can change over the years. And I'm sure, Jen, from when you were 19 and initially diagnosed, what you were told then versus what you know now. But I think that data is also very empowering. So being a little bit older at being diagnosed, I think, is a good thing, to be able to have some of the understanding and experience as well, how to research that.
Yeah, that's really good. And finding good quality research, which has changed too, right? And the years since both of you were initially diagnosed, it's a lot easier to find good quality support information. I think, that's one thing that, not to promote PPA too much in this conversation, but we've kind of set the benchmark for that, and it has made it easier. I think we've created a lot of awareness among healthcare providers too, which is why we see so many people getting better information at their doctor's offices as well as online. So, Lacey, so I'm thinking this, of course, with an eye towards some of our events later this week too. When you were pregnant with your daughter, did you have any feeling that maybe that there was something just like not right with things, or was it, was your pregnancy pretty normal and you felt fine?
Yeah, that's a great question. So it's actually really interesting what now I kind of get from different physicians on pregnancy and paraganglioma. And as most of you probably know, there is some research, but there's not a ton of research because you can't do trials on people who are pregnant. During my pregnancy specifically, I had both of my carotid body tumors removed. So in my mind, anything that was happening was just pregnancy related. I had very bad hypertension during pregnancy. I had incredibly bad symptoms. I was very sick all 9 months. I lost a lot of weight during it. And at the time, my OBGYN was like, this is normal. Some people just experience it like that. But looking at how metastatic I was post-pregnancy, one of my physicians does think that there's a correlation possibly with pregnancy and growth to tumors. I'll leave that to medical advice from physicians. But I also had to have an emergency induction because my blood pressure was spiking. It was very bad right in the end. And I do think that was probably correlated to paraganglioma. Looking back now, we also think that it was. I also had, so I had really bad preeclampsia, but I also had like postpartum eclampsia, which most people had told me wasn't a thing. But I think that it was very attributed to paraganglioma. So I also had a second pregnancy, actually right after I found out that I was metastatic. Just a month later, we found out that we were expecting again, which was a whirlwind of emotions, to go from like a low of having such earth-shattering news to be on a high. We unfortunately lost the baby, but in that I did have some growth afterwards, which was a little bit telling for me personally, but also I had the exact same symptoms that I experienced in my first pregnancy. So for me, I think that they're correlated, but for everybody else, I don't know individually how that would be.
I apologize for asking this if you maybe dealt with it when I was having technical issues, but are your tumors functional?
Yeah, mine are not.
Okay.
They are not. So I'm considered asymptomatic.
Okay. And Jenn's, I believe the same is true for you, that you don't have functional tumors, which isn't to say they're not serious, but they're not known to be hormone secreting.
I've never actually been told that term functional, but
Okay.
I would say asymptomatic. I don't have any kind of symptoms. So my only symptom I've ever had was that initial earache back when I was 19.
Wow.
And that was resolved after the radiation.
So I'll start this question with Jenn because I know like Jenn has siblings and they're affected. Do any of your siblings have children? What is their experience with the disease been like in to the extent that you feel comfortable sharing with us during this hour?
Yeah. So first I have to say PPA has been very important because it wasn't till 2020 that I began to research paraganglioma, because when I initially found it in 2019 and I just, went after my doctor's advice and did MRIs every 2 years, that's all I talked to. I only knew people in my family with paraganglioma, and I never even thought to like Google it. I don't know why, but it just was what it was. And I had it so early on in my life. I guess I just kind of knew what it was. And in 2020, when I got the SDHD genetic testing done, that's when I started Googling, and all of a sudden I found the PPA, which I believe didn't exist till 2012. So that's a huge contrast to what I had back when I was 2019, or when I was 19 to later in 2020. So I think PPA I never knew anybody outside my family before PPA that had paraganglioma. But so my dad had a carotid body tumor, and then I have 3 sisters. After I got testing done, they all followed, and they all were tested for positive for SDHD as well, which is very rare that we would all get it. SDHD is super rare. And then I think the stat I remember reading back in 2020 was that 3% of SDHD gets metastatic. I'm throwing stats out there that we probably should Google now, but it's like the rare on rare. And then SDHD was told that only the dad gene passes that on to the children. But my 2 older sisters, who both had instances of paraganglioma, they got their children tested, and 2 out of the 5 of my nieces have also received SDHD. I don't know if that's the right word, receive, but and they're young. My oldest niece is 18, and so she has not had any instance of this yet. And then my younger sister, who's just a year younger than me, she is positive for SDHD, but has not had any paraganglioma.
Wow. And Lacey, do you have siblings, and do you know if they're affected?
Yeah, I do. So like Jen, my dad also has SCHD and has a carotid body tumor. He has one. He also has a separate type of cancer that's not associated at all. So he isn't doing any like treatment or anything like that for it. I have 3 siblings, 2 of which have been tested. I have 2 brothers and a sister. One of my brothers and one of my sisters were both tested for the gene. Both do not have SDHD. So it looks like right now I'm the only one versus the one brother who hasn't been tested. And we have opted to not genetically test my daughter yet, although I'm sure we will eventually. But I'm hoping for more research down the line on that first before we get into genetically testing her.
Yep, that's completely understandable. So I don't know if it's something that you have any perspective on, Jen, like your young nieces. Do you know how they feel about that? What, you know, is it affecting some of the life choices that they might be making?
That's a good question, but it's I've left it to my sisters to kind of be in charge of like, you know, it's their children. So I haven't directly had those conversations with my nieces, so I don't want to speak on behalf of them.
Okay, that's
But
fair.
they are very there was a question at first between their mothers about whether they even let them know it to like whether to even get them tested, whether that was going to be a burden, because sometimes just know, like now having metastatic paraganglioma, that's kind of a burden and a blessing at the same time. But it's just a while, it changes everything. So there was that debate on whether they were even going to get tested initially. And I can't really speak further to their stories, just because my sisters and their mothers have a much more personal story about that than I would be able to
Sure.
tell.
And we'll talk about your family blog at the end too. But
Yeah.
we have, I think, at least one question in the Q&A. But before I ask that, I do want to ask both of you. So with a diagnosis of metastatic disease, I mean, obviously, you both seem, I know those external appearances can be deceiving sometimes, but you both seem to be, at least by now, pretty well adjusted. You both seem to be in relatively good health. Lacey, I know you're participating in a clinical trial, and I don't know if you'd want to discuss that a little bit, but how are you doing now with that? And how do you think you progressed from the initial like shock of getting that diagnosis to today and talking to us about it?
Yeah, definitely. It's a great question. It is a very difficult disease. And I think accepting being metastatic changes sometimes on the daily. I think if you ask like my family and friends around me, I definitely am very positive about it. I actually saw this in a quote from I don't remember her name, but she is a NETs patient, neuroendocrine tumors, for anybody that's on here, who has a different, she doesn't have paras, but a different type of NETs. And she wrote a blog and she put in there that her life motto is live like you're living. And I read that just after my diagnosis, and that had a huge, profound impact on me, and really changed my perspective on it, that I don't have a ton of impacts. I still get to be active duty. I still get to do and live my life every day. So I feel like I have a very positive attitude about it. I am very grateful for PPA as well, Jen, and it's kind of given me an outlet to help other patients, to talk to a lot of people. That gives me a lot of self-satisfaction and gratification, that I'm positively contributing back to it. And that kind of helps me a little bit. And I'll talk about clinical trials too, happy to, after Jen talks. Having a clinical trial, I think, has been a big part of that, because my prognosis was watch and wait. And that was devastating to me. And that was really a hindrance on how I felt about it, how I kind of accepted it. And being able to be in a clinical trial has changed the game for me. Being proactive and doing something, even if it's just contributing to the research, has, for me personally, has been incredibly empowering, and really changes my perspective and makes me a lot more positive about the future and hope, versus not being able to do anything. But some days are definitely harder than others. And I think Jenn can probably attest to this too. I am definitely in my feels sometimes about having paraganglioma, but 99% of the time I am fearless and happy to live like I'm living every day.
That's so good. So I definitely need to talk to you more, and like let's just talk weekly because I need the
Yeah.
support. I have a different, I mean, I heard a doctor about NETs say living with cancer, and that has stuck with me. And so it's not about dying from cancer, it's about living with cancer, because when you have an incurable disease, what you kind of go like, well, what am I supposed to do with that? And the answer for me was to, every day I'm fortunate to wake up with no symptoms. And so I just need to live out that one day and just keep going one day at a time. And living with cancer is, I would say, kind of a motto of mine. But Lacey, I mean, so on the opposite side, I sometimes don't get into the research, and sometimes it's hard for me to do PPA events and things because it does bring up so much emotion. So it's hard for me on that side. I mean, 3 years into a diagnosis where I am watch and wait, and I'm not currently being treated. I had some bone treatments at one point that helps to like build the calcium in your bones, since I have bone metastases. But that actually made me feel really bad for weeks. And so I refused that treatment. Yeah, so I'm in watch and wait, and I'm going about every 6 months, although actually I've taken this year as a pause because I needed it for my mental health. So my mental health became priority over, yeah. So
Yeah.
I will continue to do updated scans this coming January, but I had to take that break for my mental health, knowing that I'm living with cancer, hopefully for a very long time. I see some people who have lived shortly after a diagnosis, but then I see other people who are living a long time with this diagnosis, and I feel very hopeful for that. So it's a balance. It's sometimes when you have an ache in your bones, you're worried that that's the tumors, and then you're fine 24 hours later and it's no big deal. But it mentally comes after you a lot.
Yeah, I definitely agree. Having bone metastasis is such a funny, I say it's funny, it's not funny, but it's because every time I hear a creak, I'm like, that has to be it. Like that has to be something associated when I know that it's not. And that's where like the research piece helps me. It's interesting that you mentioned the mental health piece, and I think that's so important because in 2023, when I was diagnosed metastatic, I actually decided, I was like, hey, it feels kind of heavy on me to have annual scans. I haven't had anything. The risk is so low. I'm going to go ahead and not do them for a while. I was thinking about going to every 5 years. My doctor had already put the referral in, and the clinic had called me to schedule the scan. So I was like, I'll just do this one, but I'm not doing it next time. I'm just tired of being poked and prodded. And I'm so thankful that I did, because I got my diagnosis, and that we were able to catch it so early on, and that I was able to do something. But there's so many what ifs associated with that. But you're right, there's such a mental load that some days are harder. I have to stay away from some of the Facebook support groups occasionally because it gets too heavy. But it's important to advocate for yourself. So for anybody that's listening on that, it's just important to do whatever feels right for you is the right thing to do.
That's really good advice. We're going to circle back to clinical trials in a bit, but I want to jump into the Q&A. We have a first question. Jennifer, did you have external beam radiation on any of your neck tumors? And if so, were you told you were at risk of radiation-induced carotid artery injury or stenosis? If yes, how frequently and with what test are you monitored for this?
Yeah, so that's a big question because I was diagnosed at such a young age. I actually had pulled out all my health files and I really want to go through these when my mental health will let me. to read through everything and kind of reblog about my journey from age 19. The answer is I had cyberknife treatment, so I believe that's the same as external beam radiation. So I had that 3 times. I'm sure, you know, when they're putting you in a surgery or they're putting you in radiation, they probably had some disclaimer about the risk in things. So I can't say specifically if it had that radiation-induced carotid artery injury. I did get part of my story that I haven't mentioned yet is in 2022, a year after being diagnosed with metastatic paraganglioma, I was diagnosed with papillary thyroid cancer, which is also why I have some burnout from doctor's appointments, is because I did get surgery and a full thyroidectomy done in 2022, along with some radiation there. I have heard rumors, so don't quote me on this, but I've heard rumors that it's possible the thyroid cancer could have come from the radiation being pointed at my carotid. But I don't want to say that that's a definitive at all, because I don't know how you know, and there's no doctor definitively telling me that. So.
And do they follow you since then? I mean, is that something that they check occasionally, like just for lack of a better word, the integrity of your carotid artery? And I mean, I'm sure you get scans there to look for recurrence.
Yeah, so before I was metastatic and I just had the bilateral and the glomus tumors in my ears, I was getting MRIs every 2 years. So I think that is the testing that was monitoring that to make sure they were stable. Now being metastatic, I get PET scans with dotatate. And so I don't know what I would technically be looking for because I've been diagnosed for metastatic. So when it comes to specifically the carotid, I don't know what they would be looking for, but that could just be my poor knowledge on that.
So just to be clear for both myself and the questioner, how many years has it been since you had the cyber knife on your carotid?
The last one I had was in 2012.
Okay, so it's been a number of years and you've been fine in terms of, as far as everyone knows, in terms of the health and integrity of your carotid artery in that area.
Yeah, I don't think that's been a topic ever since I got diagnosed metastatic. I haven't specifically had any conversation about the carotid.
Interesting. The other two are actually just kind of shout outs. So just a couple other viewers saying that they have Watch and Wait too. Lacey and this viewer loves your perspective. And then Jennifer Hunt, who is on our Awareness Week committee, is giving you both a shout out. She joined us. So Lacey, let's talk about clinical trials. I know, so as most people know who know me in the community, my mom and brother both had Pheo Para, and they did both actually have, well, my brother only had paraganglioma. My mom had both Pheo and Para. And my mom was like, her health was pretty badly damaged from years of delayed diagnosis by the time that she actually reached a correct one. And so there wasn't a lot that her doctors felt comfortable doing, including surgery, because she was in heart failure and, you know, she was in her late 60s and then early 70s. But I know for us, just the act of like engaging with the NIH protocol and going to the NIH made us feel like we were still taking some kind of an active role in doing something both for her and then for the greater community. And I sense that some of that with you. So would you like to talk to us about the trial that you're in? And
yeah, I'd love to. So I'm in, it's called the Lampara study. And so I get lanreotide injections every month. So every 4 weeks I go to the NIH. I just had my 10th treatment just 2 weeks ago, last week. Very recently, all of the weeks start to blend together when you go back every 4 weeks. My experience with lanreotide has been really good. I get asked that a lot, and that's probably what I respond to the most when people ask about it. The side effects on the first couple were a little rough with like stomach discomfort. And the fatigue was pretty bad initially. But once I got past that, it was very easy Being at the NIH has been very easy. One of the best parts about being in a clinical trial at the NIH is there's a few other clinical trial participants that are getting the same lanreotide injection, and one who's getting a different type of treatment, who we all kind of go around the same time. We're not always together, but we've formed our own mini support group where we talk all the time. We talk about symptoms, things going on with having para, research that we find on there. And it's really nice to just have people to commiserate with that feel the same way that you do, or just to have the same experience or to talk about what you've had. And it's also so amazing to have physicians and medical personnel who just understand you. One of the nurses that's on the trial, the very first day I was there and she walked into the room, she was like, all right. She had a typed piece of paper and she was like, I'm going to read your medical history to you. And I just want you to tell me what I've missed and fill in any gaps that's in there. And she read out everything, which once you've been in for a little while and the years of like scans and everything, it's a lot to like talk about and to explain Pheo and para to a normal physician. So I literally broke down, and I thanked her for just knowing my medical history, first of all, and being prepared for walking in there. But every single person that I encounter that I work with there just cares so much about you personally, and it helps that they're invested, their entire professional lives are researching Pheo and para. So that's really helpful, and it's very refreshing for me to not have to explain my diagnosis to them, but for them to be helping me with that. So my doctor tells me all the time, she's like, you worry about doing your life and being Lacey, let me worry about para. And that's such a reassuring thing. And if you know who my doctor is, you know that that's exactly who she is, and her personality. So that's very helpful. I'm super happy to answer anything about clinical trials too, if anybody has a question about that, but it's a fairly easy process. Lanreotide for me has not been bad. It has been a little bit difficult for a few of the other people in the trial, but they're around the same number of treatments as I am now, and it starts to, for us, has all tapered off on there, but it is very individual. Each person feels very differently about their symptoms on it.
I have a question.
Yeah.
Since I have not experienced that, what is the process? How is that received? Is it through, like, I've done a treatment where it was through like a medical bag?
Yeah, lanreotide is a shot. So it's just an injection that you get. It's really easy. I think the worst part about it is that it's a very large needle. It's like the size of my palm. I have a picture of me holding the injector in my hand, but it's pretty simple. It's one injection. It's crazy because like them taking my blood pressure right before is longer than the actual treatment because it takes 5 seconds. It actually takes 20 seconds per the directions. You have to wait 20 seconds while it's plunged. But that's it. It's just a shot. It does get kind of sore for the first couple of days. And I usually fly home that evening after treatment. So sitting on it, because it is on your upper backside, sitting on it is not very fun for the first day. So flying home after that is not my favorite, but that's about the worst of it. And I will take that any day of the week.
Do you have to do one of my injections, I always had to go and do blood testing like an hour before. Do you have to do that?
Yeah. So with lanreotide, if you have it as your normal, if you're getting it as like your normal treatment, not a part of the clinical trial, there isn't any other blood work that's associated. For the trial though, we do a full workup every time. So every other treatment I get a scan. So when I have a scan, I have a little bit more blood work that I have to do. I get a CT with contrast every other, and that's one of the side effects that they talk to you about is you're getting a lot more radiation than a normal person. Because usually I'd only be getting a scan once a year, and now I'm getting it 6 times in a 12-month period. And then I'm actually extending on the trial for the next 2 years. And with that, the next 24 months, I'll have at least 5 to 6 more scans in there. So it's a little bit less, but I do normal blood work. We do metanephrines, everything else that's associated with that. And then like just regular CBC blood work, For a while, we did the 24-hour collection too, but we don't have to do it anymore, which is really exciting. And now we just do the plasma, which is much easier.
So how did you get connected with this clinical trial, and what was the process of like finding it and then getting accepted into it?
Yeah. So I mentioned on my initial diagnosis that it was just actually absolutely earth-shattering to me that I now was watch and wait. So I actually found it through the patient conference that PPA had at the NIH. It was, I want to say it was in September last year. So right before that, on a random Facebook group, I started doing as much research as possible. When I was initially diagnosed, my genetic counselor told me about paratroopers, which merged with Pheo Para or the PPA a while ago. So like Jen said, I did not do a lot of research after my initial diagnosis. Once I was metastatic, I knew everything that there was on the internet. So I found the NIH. I found that what my options were. And once my oncologist said that we were going to be watch and wait, I started emailing everybody. I emailed Dr. Del Rivero at the NIH. I emailed Dr. Pasak, and I said, here's all my scans. Here's my life story. Can you tell me anything? So they actually both personally responded back to me and connected me with their nurses. So I cold emailed the NIH and got the doctors to respond to me. You can do it that way. You can go on the NIH website or you can just find a clinical trial either through the PPA website or through the clinical trial. I think it's .gov or .org. Don't quote me on that, but you can, they have the contact information there if you find a clinical trial that you're interested in. And once they do that, a nurse calls you and starts asking you some questions, and then they bring you out for like an initial screening, and they will answer any and all questions you have about being in a clinical trial, side effects, etc., and do all of those things. So it's pretty easy to get accepted into a protocol as long as you fit the specific bill of the protocol. I know some people struggle with that a little bit. If they don't fit into a protocol, it can be frustrating that you can't be seen at the NIH. But a lot of the doctors will still give you some advice on who to talk to, other places to go if you don't fit a specific protocol. I think I answered everything you asked.
Yeah, I think you did. And did you need I know when we got my mom and then my brother into the protocol, my mother was the first person and my brother wound up getting in because my mom tested positive for a genetic mutation. But for her to get in, we needed a letter of referral from her physician. Did you need anything like that as well?
I didn't. Nope. They just needed my
great.
scans and my confirmation that I had SDHD for my genetic counselor. And with that, they didn't need it. They do accept referrals too. But if you have all of that documentation, they didn't need it for the protocol. I think there is some if you are involved in a surgical trial, but that's something that they tell you if they need that piece of it. So I also get asked a lot about how much I pay for the trial. I don't pay for anything. The NIH covers everything. And nothing is done through my insurance. It's all through the NIH.
Including your travel and everything?
Yep, including my travel.
That's amazing.
That's great.
Yeah.
So we do have a question about this in the chat, and it's how do I find this trial? So as Lacey mentioned, you can go to the Pheo Para website. Under the Patients tab at the top menu bar is a option to choose clinical trials, and that will take you to the clinical trial finder on ours that's already preset to neuroendocrine tumors, and you can enter that you have Pheo Para, and then you can either go directly to all trials from there or enter some more filtering criteria. Or as Lacey mentioned, you can go to clinicaltrials.gov and do pretty much the same thing and get the same results. So, but I think the clinicaltrials.gov does default to worldwide trials, and on the Ancora tool that's on our website, it's easy to filter it to your specific area. I think it can even do a location determination, like where you are, and then show you trials that are near you. So, so Jen, has anyone in your family participated in a clinical trial? I mean, clearly you haven't, but have you or your sisters rather? Or...
No, Both of my sisters have done, well, each one did different actually. One has done a surgery on hers, and then my other sister had hers also done with CyberKnife. So no, and no metastatic for them. So no clinical trials.
Interesting. And so I think we should also say, so different protocols, if, for example, if you find a clinical trial that's not the one that Lacey's in, it may only pay for lodging or only pay for travel, but typically if you're going to the NIH for a clinical trial, the treatment that you receive as a part of that trial is something that's you never pay out of pocket for. I mean, we all through our taxes pay for what goes on at the NIH. So I guess all of us are paying a little bit to support this, but in terms of what a patient, each individual patient has to come up with, it's at most it's usually either travel or lodging. So it's great to hear that the LEMPARA trial is just, it covers everything. That's so great. So do you stay at the Safra Lodge when you go there, the patient lodge?
I don't qualify for it. So they do like, it's up to you if you want to do like a financial qualification for it to see if you qualify for it or not. I personally don't qualify for it. And it also depends on like how long you're at the hospital or like what type of care that you have. So for our study, we aren't, so they give us like a base rate for lodging, which Bethesda is expensive. So the base rate does not cover a Bethesda hotel room, but it's only a little bit out of pocket for me. So it's something that I think is really worth it for that. So LEMPARA is still an open study right now. It was closing, but the principal investigator still has it open. So it is out there on the clinical trial if you're interested in looking into it.
And is it LANPARA? Just so that we can tell everybody, LANPARA?
LAM as in Michael, PARA.
Great, thank you. All right, we've got another question. I also cold emailed the NIH and was put into a trial based upon my diagnosis and records. I agree, Lacey, being in the trial helped me learn about my tumors and made me feel better knowing I was contributing to research. My travel costs were not covered, but my lodging and care were. This was years ago. It's great to hear that experience has been consistent. I mean, it's consistent with what we experience at the NIH, and I've known many people over the years. I'm sure you both have obviously have connected with many people who have gone to the NIH, Lacey, because you're there, and Jenn just being a part of the community. So what else would you like to tell the community about living with metastatic disease and being symptom free for the most part, but yet also having this illness that is kind of lurking there?
Well, I think a phrase that both Lacey and I mentioned was that our doctors said that we were watch and wait, and we're both treating that differently. But I think, like, to me, especially by my 2-year mark being metastatic, I was like, I don't want to wait for this to start growing, because they tell us it's slow growing, but it can grow quickly at any time. At least that's what I've been told. So you just never know when it's going to happen. And to the idea of sitting here for another year and year, watching and waiting, it just sounds very passive. And I wanted to be more proactive. So for me, I'm doing other things, looking at nutrition and reducing my stress and doing things that I can on some level control. So I'm not doing a direct treatment as of right now. But it sounds like Lacey had also that issue with the phrase watch and wait, because it's like, what are we waiting for, to die? Like, I mean, that doesn't sound fun to me. I don't want to wait to die from this.
Yeah, I agree. I think it's whatever you personally, what feels right to you is what's right. Pheo and Para, there's so much that changes with research, with your symptoms and your experience with physicians, that it's such a personal journey. But connecting with other people is really helpful, just to have somebody to commiserate with and talk a little bit But a diagnosis in Pheo and Para maybe years ago may have been something that there wasn't any information or anything out there to help you with, but with like PPA and advancements that are being made now, there's so many opportunities out there to have a little bit of hope in it, and to have find the silver lining or some positivity in it. And I fully believe Live Like You're Living makes it a little bit easier, although I know that some days are still going to be hard, but there's a whole team of people who are behind you, who feel the same way that you do, and are happy to support you.
Well, that seems like a great place to start wrapping this up. I had another question, but I'm not sure. I don't want to like end on that. Before we do hit the top of the hour, I do want to run through some things. As everyone knows, and you can tell by our backgrounds, we're in the at the beginning of Pheo Para Awareness Week. We have more events planned after today. Tomorrow, I know many of you probably have a lot of questions about disease and treatment, including surgical and non-surgical treatments. And tomorrow, the American Association of Endocrine Surgeons will be holding their annual webinar at the same time, 5 p.m. Pacific, 8 p.m. Eastern. If you haven't registered for it yet, there's events set up on the website and our Facebook page to sign up and get the link to join. And I've said this every time that I've had a chance to in the last month, but this is always an exceptional webinar, and it's a really great place to come and get your questions answered. And if you can't attend, we are recording it. Register and submit your question, and we'll make sure that your question is on the list, and hopefully we can get this great panel of experts to address it. And then on Thursday, the 29th at 4 p.m. Pacific, 7 p.m. Eastern, we will be taking a look at solving the mystery, family planning and pregnancy. And we'll be looking at specifically how Pheo and Para can affect pregnancy and or family planning decisions that you'll be making once you know that you've been diagnosed and are positive for a genetic mutation, like our guests today. And so I wanted to make sure to get those things out of the way. I do have a closing question. Maybe you guys can, we'll close on this, even though I thought the Live Like You're Living thing was really great. And that's the advice I want everyone to take home with them. But both of you, Jen, you've got that giant folder of information there. And Lacey, you mentioned your medical history and how it's a lot to keep track of, you know, for yourself and obviously probably for your caregivers too. And as a caregiver, I've definitely been there and have had giant notebooks that I schlepped around with copious notes and everybody's stuff. So what are your strategies for keeping that organized and keeping on top of that you could share? Like, do you have any tips or tricks that you'd like to share with everybody before we close out today?
Well, for me, it's literally in the folders. There they are. But what I would like to do is start sorting through this and like reflect on it in my blog and share some of it. I'm noticing that my doctor's notes are illegible, so that's going to be a challenge. But at least it gives me a timeline of things and I can try to reflect back on what that was. The other thing I do, I'm being cared for by the Mayo Clinic, so they have a really good portal. So I definitely love technology these days, as far as being able to go back and look at my history. But I am also keeping a Google Drive of everything that I come across, because especially since this is genetic and that now my nieces have it and maybe I have future children, that's still a question mark. Knowing that that's going to be in the history of my family, I would like to pass digital files or whatnot down so that this isn't a mystery, especially within my own family. And if I can record that in a blog, hopefully that could help other people too.
I also have all of my information in the exact same type of folder that Jen has in it. I am very fortunate that my caregiver is my husband, who is very organized, and any medical information that I have, he puts straight into a folder so that I have it all there. I still find it difficult though to remember all of my things, but I also use the NIH portal a lot. But I think it's important too just to have like it at least somewhere for you to keep it all together. And I prefer the old school in a manila folder with everything all together.
All right, we have one last question from Q&A, and I think this is a nice one, so we'll end on this. Lacey, what do you attribute your positivity to? Is that just who you are, or do you have something or someone you found that has made a difference in your life?
Thanks for the question. I think that overall I've always been like a super positive person, and I think a lot of that is just from my mom and how my mom is, and I think positivity is also a really good crutch for me to deal with everything that comes through with life. But as I've grown, I think that's changed a little bit. And right now, I would say my biggest positivity really just comes from I have a phenomenal support system, and my daughter is my whole world and my life. And just being positive makes it a little bit easier for me with her. You can probably hear her in the background now too. But that's really, really what I use, as where I get my positivity from. So I definitely have my days though.
And Jenn, you have a blog that you keep with your sisters. I know you say you want to like be more active on it, and I can see that we're, heading that direction. So I think that there's positivity in the name of that. Would you like to talk about your blog and give everyone the name of it?
Yeah, so it's called the Joyful Dazzle. So for people who don't know, a group of zebras is called a dazzle. And zebra is kind of the symbolic form of rare disease. So that's where that name came from. So it's thejoyfuldazzle.com. And it started fresh back in 2021 when I first got diagnosed, and it could use some refreshing. But I thought it would be interesting to have the 4 perspectives of me and my 3 sisters on it, with however they would like to participate, and how I set it up for us all to be able to have access to it. And I did have this big dream that someday it would grow and other zebras could be on the joyfuldazzle.com sharing their stories, so that it was a collective of everybody's paraganglioma and Pheo Para stories. So it's there, and I think now that I'm in year 3, I think I can start to dig into my files and start adding to that blog. But as I mentioned before, like the last 2.5 years especially, was just so hard having the diagnosis, that to even really write about it was not very good for my mental health. So I'm hoping that I can get to a place where I can share more as I get, I guess, more comfortable with this diagnosis.
Sure. Yeah, I understand. Well, I appreciate both your time. I want to do 2 things before we close today. The first is, as many of you probably are aware, typically Miranda Edwards, who does the Pheo versus Fabulous blog and social media pages, would do a Tuesday slot with us during Awareness Week. And she's now, of course, dealing with 2 kinds of cancer, both thyroid cancer and metastatic Pheo. And her health didn't allow her to participate in this year. So we wanted, and we talked about this beforehand, to dedicate this hour to her. And if I'd not had technical difficulties at the beginning, that's when we would have done it. But we definitely want to dedicate the previous hour to Miranda and tell her that she was missed, and inspiring us along the way. And also just let everyone know that if you'd like to get involved with Awareness Week, you still can. There's lots you can do, including downloading our social media assets that Jenn helped create this year, and she's just amazing. She always takes my like crayon drawings and turns them into things that actually look professional and that we would want to post online. So you can go to pheopara.org/2024 Awareness Week, all one word, and you'll find the social media assets and a schedule of events there. Again, I want to thank everyone for their time today and their questions. I think that we've got a lingering one that we just don't have time for today, but maybe we can pass it along offline. Thanks to Jenn and Lacey both for especially pinch hitting at the beginning of the hour when my battery died on me unexpectedly because my charger was dead. And again, thanks to everyone for attending our event today. And we look forward to seeing you throughout the rest of Awareness Week and the rest of the year. Thank you both so much for attending. And I'm going to, remember, live with cancer and live like you're living. These are good words for all of us, I think, to remember and try to think about every day as we're struggling with with things less serious than metastatic paraganglioma, certainly. Thank you both for providing the perspective and
you.
information today and being so open with all of us.
Yeah, thanks for having us.
Thank you.
Thank you.